I have a little cognition tip for you. We were talking earlier yesterday about how important it is for our children to be able to do perspective taking. And there are a lot of people out there who recognize this. There was a study done by Simon Baron-Cohen a while back called the Sally Ann test, right? And the Sally Ann test, what they did was they took 3 groups of kids. They took a typically developing group of kids. They took a group of children who were on the autism spectrum and a group of children who were born with Down syndrome. And they did this test to see if they could understand another person's point of view. And what they found, and I won't go into the whole test right now because I want to get to the tip, but what they discovered, which was really interesting to the entire community, was that at the age of 5, that typically developing children can stop and consider another person's point of view, and that they do. They just automatically start doing that. And that children with Down syndrome at the age of 5 can begin to determine other people's perspective, their point of view, in order to problem solve. But that overwhelmingly, children on the autism spectrum do not. So we know that this is at least a part of the puzzle piece, the missing piece, right? To be able to have our children lead happy, productive lives. And what we see sometimes, how this it shows itself up in our everyday lives, is that something will happen and someone will be upset, understandably so. You and I can understand why they're upset, and the child who is on the autism spectrum is standing there and they're happy. And we find ourselves in that frustrated saying to that child, you know, don't you understand your brother or your sister is really upset right now because of the thing that you did? Do you not see that? And the child is standing there saying, but I'm okay. I'm happy. And they really are emotionally disconnected to the fact that this thing happened and somebody else is upset, because they have a difficulty taking that person's perspective. It will mean that sometimes they will say something that hurts somebody else's feelings because they don't realize, they're not thinking about it from that person's perspective. So how can we change that? And can we change it, I think is the question that a lot of people ask, and there is an assumption that you can't change it, but I got to tell you, you can. If we take the principles of ABA and apply them to these kinds of cognitive issues, we see and have seen in studies that you can make a difference. You can absolutely make a difference, and there's even a study that I'll have to see if we can have Dr. Tarbox talk to us about, where you can see a difference having done this kind of therapy literally on a brain scan, that it kind of wakes up a portion of the child's brain and kicks it into gear. That's pretty exciting. And so we can work on perspective taking with children. And if you're curious about how you do that, I want to again refer you to the skills program, because there are a whole series of lessons, and I'm just going to talk about one aspect and area of it today, sensory perspective taking. But imagine, if you will, that first a child is introduced to what the senses are. And they're introduced to it both, talking about it, but in an experiential way. You know, what are the senses? What can you touch? What can you see? What can you hear? What can you feel? All of these different things. And then a child is taught to be able to understand how they think and know things based on those 5 senses, right? So if they're hearing a bell ringing someplace else, and they know that that bell means that the ice cream truck is in the neighborhood, and so whoever is working with the child says, where is the ice cream truck? And the child says, you know, it's outside. How do you know? How do you know? And the child says, because I can hear the bell. And we can work on the child noticing those kinds of things and identifying which one of their senses is linked to it. And the child begins to have a better understanding of, okay, if I hear something, thinking it through, what does that mean? And I can hear it, so that means that the ice cream truck is out there. It adds, it's a way of looking at thinking as behavior. It's really, really fascinating. And so that's one way of beginning, but then at some point, we need to start to take other people's perspectives, and we do that with the senses. And so we contrive circumstances, and the lessons are all there in skills, and they give you step-by-step and teaching tips and points, and it's wonderful. But imagine that you set up a circumstance where the child can see something, and whoever is working with the child, the therapist or one parent is there with the child, they can see something, but you contrive a circumstance where there's somebody else, where whether it's another child or the other parent is in the other room, and say, you know, what do you see? And the child looks and says, well, I see the pink teddy bear. Great. That's absolutely fabulous. How do you know where the pink teddy bear is? I can see it. Wonderful. Can mom see the pink teddy bear? And in the beginning, the child is more than likely going to get it wrong because they haven't stopped to consider mom's point of view. So the child might say, yes, the mom can see the pink teddy bear. At which point then, you know, the therapist says, really? Where is mom? Mom is in the other room. All right, let's go stand where mom is standing. Okay, so we're standing right there. Okay, can we see the teddy bear right now? No. And then you go back to where the teddy bear is. Can you see the teddy bear now? Yes. How do you know the teddy bear is on the table? Because I can see it. Okay, can mom see the teddy bear? And now the child's having to think, okay, I was just standing there where mom was standing. And, you know, there's still the possibility that they're going to get it wrong, but they begin to start to think about, okay, I'm here, I can see it. Can she see it? And then you might have to go back 5 times and stand where mom is. So that they're literally standing in mom's shoes, right? And seeing that they cannot see the teddy bear. Now, we're always working towards generalization. So there's no possibility that you can teach this lesson in all the myriads of ways that you would need to teach it for a child to be able to learn directly how to take perspective, someone else's perspective. But if we give enough opportunities and do it with enough circumstances, with enough of the senses, what we see is the child starts to generalize it. And that it's an amazing thing when you see this light bulb start to click on with the child, because they do start to think about things from other people's perspectives. It's absolutely amazing, such a fun thing, and you get to the point where, and again, this is something you work on and work on and work on, and you set up different circumstances, and it isn't always visual. Sometimes it can be, you know, what do you hear? How do you know where it is? You can, you know, you can hear the truck. How, you know, can you touch this? All of the different senses, and working on it with that third person being able to see it, not being able to see it, so that the child is getting it from all these different directions and starting to have a global understanding of perspective taking. And I remember the moment when I realized, oh my gosh, my child really has this. And we had worked on this for a really long time on a myriad of different circumstances. But it was his birthday party, and we were going over, as we do every year, sort of the social rules of how do you behave at a birthday party, what kinds of things do you say, and when you open your gifts, and what do you say to everybody. And we went through what happens when somebody gives you a gift that you already have. Do you say, oh, I already have this, and, you know, throw it to the side? Or do you say, thank you very much, while in your head you're thinking, mom will be able to exchange this, right? You know, and that you don't say that, thinking that through and kind of talking in the car as we were going over to the birthday party. And I said to him, okay, what happens if somebody gives you a gift that you really don't like? And he said, I'm going to say, thank you very much, I really like it. And I was kind of, you know, taken aback by that response, because it wasn't the response that had been there a year before. And I said, well, why are you going to do that? And he goes, well, Mom, because they took the time to go pick it out. They must have thought that I was going to like it. I don't want to hurt their feelings. That would be rude. Wah! And the angels sing. And you get there by teaching it in this way. You can't have the expectation that they're just going to pick it up. They're not going to just pick it up. But we can teach it. Amen.